Dealing with a dementia patient who is aggressive. The aggressive actions of a dementia sufferer can be physical or verbal in nature. Outbursts may occur suddenly, seemingly out of the blue. Imagine slowly losing your mental faculties, having a memory which comes and goes, and being frustrated by a feeling of helplessness. This is what the dementia patient goes through on a daily basis. On top of the mental causes for aggressive behavior, communication issues, environmental problems, and being physically uncomfortable can cause someone to act out. What caused the outlash? The first step to dealing with a dementia patient who is abusive or aggressive is to identify the cause. In most cases, the reason the dementia patient is upset is because of one of the three following factors. 1. Communication problems. 2. Physical discomfort. 3. Environmental issues. Ask questions. Try to identify the underlying cause of the aggression. Understanding what causes aggressive behavior is the first step to removing or limiting that influence. Communication problems. When someone with dementia is having a problem understanding you, she can become frustrated. She's trying very hard to communicate with you what's going on, but since she can't fully make out what you're saying or what you're asking, she becomes very angry at her inability to communicate properly. This can lead to physical or verbal aggression. Make sure you speak slowly and use simple instructions. It could be that you're making it difficult to understand what you're trying to communicate. Look the patient directly in the eyes when talking to them. Try not to cover too many topics or ask too many questions at once. Also, make sure any stress going on in your life is not coming across in your speech. Physical discomfort. If you've ever been confined to an uncomfortable chair during a long business meeting, you know how your physical comfort level can dictate your mood. When you're uncomfortable and don't feel like you can remedy the situation, you might experience frustration and maybe even anger. Sometimes an uncomfortable situation that leads to aggressive behavior in a dementia patient can be caused by internal pain. When aggression takes place, ask the patient if he's feeling internal or external pain. Is thirst or hunger a problem? Is the patient hot or cold? Did feelings of discomfort appear shortly after taking a medication? These are the types of questions you should ask so you can alleviate whatever's causing physical pain or discomfort. Environmental causes. The many forms of dementia are often accompanied by an inability to recognize surroundings. Did the person with dementia act out because she felt lost and didn't know where she was? Are there loud noises or many people speaking at the same time? These are just a few cases when a person's environment can cause them to act out. When any of a dementia sufferer's 5 senses are stressed to their limit, aggressive behavior can be the result.